Tonight I'd like to go over my hierarchy of medication evaluation. This is the thought process I go through whenever I'm evaluating a patient's medication list and trying to determine the appropriateness of their regimen. This hierarchy is structured much like Bloom's taxonomy, with the most basic skills at the base of the triangle and the most complex higher order thinking at the top of the pyramid. Now I'm going to use the example of a patient who has hypertension and you're thinking about starting amlodipine in this patient. Now, the first step in the hierarchy is to see if the patient has an indication for that particular drug. So in this case, the patient has hypertension. I look at amlodipine. Amlodipine is an antihypertensive, so that seems fine. So at this level, it seems that amlodipine would be fine for this patient. The next level you would look at is dosing. So is the dose of 10 milligrams once a day appropriate for this patient's renal status, for their hepatic status, or whatever special dosing changes need to be made? You need to check that before okaying that particular drug. So in this case, Norvasc 10 milligrams once a day for this patient for hypertension seems appropriate. So at this level, amlodipine seems to be an okay choice for the patient. Now again, these two steps are the most basic skills you would need to have to evaluate a patient's medication regimen. But I want you to be up here at the top of the pyramid. This is higher order thinking using critical thinking skills to determine appropriateness of a medication. The next step you want to think about is ask yourself this question every time before you approve or okay a medication order. And that is, who should not get this drug? Is there any reason why this patient should not get amlodipine? In other words, that means, what are the contraindications to the drug you're recommending or that the patient is on? Are there any major side effects that this patient may already have? So if I told you that this patient with hypertension has peripheral edema, then amlodipine would not be a good choice for that patient, because we know that amlodipine, one of the major side effects is peripheral edema. So you need to ask this question every single time. And it's a much easier way to catch medication errors or issues by asking this negative question, as opposed to asking who should be on this medication. If you ask it in the positive, there's way too many options. It's too broad of a question. So ask yourself, who should not get this medication? Now, as you get to the highest point in the pyramid, you want to now look at, is this the best medication for this particular patient with this particular condition? So if I told you that this patient had systolic heart failure along with hypertension, then you would say amlodipine is not the best choice for this patient, because they really need to be on an ACE inhibitor and a beta blocker because of their heart failure as well. So in this case, when you check this question, amlodipine is not the best choice. So you can see that as you work your way up the pyramid, your assessment of whether the drug is appropriate changes as you get to the top. So I would like you to think about this process in your mind every time you're evaluating a patient's medication, and it will help you organize your thoughts and determine whether or not it would be okay to start a particular medication or continue a medication. I hope that helps. Have a good night.